Hi everyone, my name is Evangeline Wagner, and this is our presentation on the use of robots to support those living with dementia and their caregivers. I worked with Dr. Elizabeth Borky and Dr. Andre Kushner on this research. We are from the School of Health Information Science in Victoria, BC. Quick introduction. So dementia and other related diseases are being increasingly diagnosed, and related diseases include anything that causes a mild cognitive impairment, and over 47 million are affected worldwide. So there's a growing need to support our patients and our caregivers who are affected by this disease. The use of technological tools can assist with caring for patients who remain at the home and supporting their caregivers by challenging the system to provide a higher level of care and create solutions that are more accessible to everyday patients and their caregivers. Our objective for this research was to assess the current state of the literature regarding to the use of robotics in the home for dementia care specifically, to examine the suitability of robotics to assist with activities of daily living and instrumental activities of daily living, which we'll get into in a minute, and to understand the perceived benefits that robotic devices have and that can provide in this context. So a background. The definition of robotics that we used is a physically embodied system that is capable of enacting physical change in the world. So in this context, robots can assist with ADLs and IADLs. So an activity of daily living is a basic skill to care for yourself. So personal hygiene, grooming, dressing, and eating, etc. An IADL, or instrumental activity of daily living, is an activity that can allow an individual to care for themselves independently. So shopping, meal preparation, communications, remembering to take your medications, and this requires a little bit more complex thinking. Our methods for our review was a scoping review using ARC-CM O'Malley methodology and PRISMA guidelines. Our literature search was from 4 databases: Medline, PubMed, IEEE Explorer, and Web of Science. The search terms that we used were dementia and robotics. Inclusion criteria was empirical studies. We wanted a context with ADLs and IADLs, robots to be involved, and dementia and aging. Exclusion was not specific to ADLs or IADLs, functions, or dementia. And our data extraction included 13 articles. So as you can see, if our PRISMA diagram, we had 907 studies imported for screening. 853 were titles and abstracts were reviewed, 54 full texts were reviewed, and 13 were included, as I said already. Our findings, so article characteristics. Most of the articles that we had were from the years 2013 and 2020, so this is relatively new research. Nearly all of them were qualitative, so using focus groups, interviews, user questionnaires. Study methodologies were mostly literature reviews, mixed method studies, and quasi-experimental studies. And authors represented 7 different countries, and nearly half of them were from the United States. The others were Poland, Finland, France, Austria, Spain, Canada, and New Zealand, so quite varied. Continue. The majority of studies focused on the needs of older adults in the home early on, and then later developed into more developed descriptions of robotic functions. And 3 principal themes emerged from the literature that we extracted. So 1 was robot functions, 2 is research areas, and 3 was assisted living. So robotic functions, all the articles included a discussion of what functions the robot can actually perform, and the majority of those focused on IADLs, instrumental activities, and these involve tasks that do not require the robot to physically touch the patient. And examples of these were medication reminders and emergency assistance, so calling EMS if needed. Very few ADL functions were discussed, so very few robotic devices can help with washing and eating and mobility at the current state of the literature right now. Our areas of research, most studies included in review were conducted in several different contexts, which was interesting. So some were done with a more technical lens, including descriptions of more technical functionalities and how it would work, and others primarily focused on the patient impact and the clinical context. And lastly, assisted living. So the majority of them included keywords and background and discussion about assisted living, and the majority were intended for the home environment and benefits for patients. Moving on to our discussion, we found that it was more feasible for robotic devices to be used in the IADL context, and this also includes phone call reminders and fall detections and psychological support, etc., as you can see in the diagram here. ADLs require a physical touch, and at this point, as I said before, the literature does not reflect that. There is a very vast difference in the needs regarding instrumental activities of daily living and activities of daily living. There is a lack of evidence to support that robotic devices can be used to assist patients with dementia. However, they can be used in the home for daily tasks, so it can be concluded, or it can be suggested, that it will work with dementia patients, but we need more studies to determine that. So trials involving representative users for both patients and caregivers would be very beneficial. And also, as I've said multiple times, further studies required to assess the suitability for ADL assistance. There's no evidence to suggest that the devices included in the study are suitable for ADL assistant needs. Before I end off, I would like to acknowledge with respect the Lekwungen peoples on whose traditional territory this research was conducted, and the Songhees, Esquimalt, and Wasanic peoples on whose historical relationships with the land continue to this day. And thank you very much. Again, my name is Evangeline Wagner. My email address is here. Please don't hesitate to reach out to me. I'm from the University of Victoria with the School of Health Information Science. Thank you.